wonderful day to each and everyone. We are from the University of Baguio, School of Nursing from the section NCA1. Please allow us to present our work in discussion about the immune thrombocytopenia.
My dog Ellie keeps me busy every day. She enjoys watching me fixing her toys and she really appreciates life. My name is Elsa and I've been diagnosed with immune thrombocytopenia or ITP. So in 2012, I began to notice these strange symptoms that didn't match up. My lower legs are covered with tiny red or purple prick dots. I was also getting these large bruises which are known as hematomas. They were painful and they covered my legs from top to bottom.
Legs are covered with a small petechia, a little red spots which are microvascular bleeds that combine with bruises. The hallmark of skin manifestation of ITP.
My family urged me to see my gynecologist because they were concerned about these massive bruises. So I went to my gynecologist who looked at me and said, "This is a job for hematologists, but let's draw your blood and see what's going on." So she called me at work the next day and said, "Elsa, your platelets are at 7,000. You need to get an ER or you're going to die." So I went into the ER, handed them my blood work the day before, and after 2 minutes, a group of people arrived and take me back into the ER. I was in a hospital for 6 days and had no answers. I felt like I was watching my life slip away and completely out of control.
Almost all patients want to know, why did I get this disease? That's the question we can't answer, because it can occur in almost anyone and in any ethnic group or genetic background. But they need some trigger that probably brings it forward. It's in fact the diagnosis of exclusion. If the platelet falls below 100,000, you can define another cause that you presume that the patient has immune thrombocytopenia. It always confirmed as a hematologist by looking at the blood smear.
When I was diagnosed with ITP, I seriously asked questions if life was worth living. ITP took everything from me. It had stolen my independence, my financial security, and even the career that I was building. I was nervous, scared, and worried, and at the same time, I became angry. I asked a lot of questions like, why me? Why now? Why this? I eventually went from being fearful to wanting revenge and control, as well as figuring out what's wrong with me and how to fix it. I didn't want ITP, and I was determined to win.
When you were living with low platelets, you will realize that there is a possibility that you will bleed to death, and that can be really scary. All I ever known is having ITP. When I was 4 years old, I had a lot of bruises all over my body, and my mother knew that something wasn't right, so she took me to one doctor and another, and I was diagnosed with ITP. At that time, not a lot of people know about this disease. They only knew that this was something that they have to be cautious about. I couldn't be a rough and tumble type of a child. I guess it is kind of like living in a force field around me, because anything intruding into that little force can damage me, or it can cause bruises, or it can injure me. So when I was diagnosed, the only treatment at that time was steroids and splenectomy. And of course, the first treatment that they have given me were steroids. As time passed by, the medicine stopped working. The medicine didn't rise my platelet count anymore.
Corticosteroids alone is a really effective medication in inducing long-term remissions in about 15 to 18% of individuals who are taking this medication. However, to those patients who failed to adequately respond to steroids, the only treatment available to them is removing their spleen or undergoing for splenectomy.
So when I was 7 years old, I had a splenectomy, and that worked for 3 months. It elevated my platelet count, but after 3 months, my platelet count dropped again. I just live with the low platelet count, and that is not until I think in my late teens was there another treatment that is available.
I think that this splenectomy will always be the last resort anytime you're dealing with an autoimmune or immune-related processes. However, the steroids are the first-line defense in increasing your platelets with regards to this condition, the immune thrombocytopenia. But if this medication does not work adequately, we move on and we go to a further agent that frequently works in about 70% of patients taking this medication. It is the intravenous immunoglobulin, which frequently and rapidly works in increasing your platelets.
I ended up researching potential treatment options, and I discovered that I fit into a group of people for whom this particular treatment may work best. So I went into my doctor and told him what I wanted to do. And he told me that was the treatment I would recommend for you as well. In September 16, 2012, we completed the treatment and was declared a successful one. And within that day, I considered it as my second birthday.
Patients that are diagnosed with immune thrombocytopenia have immune system that is hyperactive. Physicians prescribe corticosteroids to these patients, which inhibits their immune system. Inhibiting the physician's immune system will cause the platelet count to increase. Example of corticosteroid is prednisone, also known as Rios.
Immune thrombocytopenia is the intravenous immunoglobulin or the IVIG. So this medication is administered just like an intravenous fluid which passes through an IV line. So basically, this medication is stored in a small glass bottle and contains an immunoglobulin, specifically the immunoglobulin G or the IgG. So intravenous immunoglobulin is a medication administered to those patients who are severely bleeding and has reached their critical level. It can also be administered to those patients who will undergo surgery to increase their platelet counts quickly. Additionally, this medication is a first-line therapy for people who have immune thrombocytopenia due to its effect on temporarily increasing their platelet counts.
Another drug prescription is anti-D immunoglobulin. This anti-D immunoglobulin is like intravenous immunoglobulin. However, this drug works faster and quicker in causing your platelet count to rise. Anti-D immunoglobulin is for Rh positive patients only. And these drugs comes with serious side effect. So as a nurse, you need to health educate your patient about the serious side effects.
So for the lifestyle changes, your doctor may also advise you to make some lifestyle changes, including avoiding certain over-the-counter drugs that can affect platelet function, like aspirin, ibuprofen, which is Advil or Motrin, and the blood-thinning medication warfarin, which is Coumadin. Limiting your intake of alcohol. Consuming alcohol can adversely affect blood clotting. Choosing low-impact activities instead of competitive sports or other high-impact activities to decrease your risk of injury and bleeding.
Your doctor may also advise you to make some lifestyle changes, and that includes limiting your intake of alcohol because consuming alcohol can adversely affect the blood clotting.
Antibiotics. So, antibiotics are the medications that destroy or slow down the growth of bacteria. So, Helicobacter pylori is the bacteria that causes most peptic ulcer. It has been associated with immune thrombocytopenia or ITP in some people. If other medications don't work on the people who have ITP, some doctors may consider prescribing antibiotic therapy to eliminate H. pylori because it has been shown that if a person diagnosed with ITP and they have low platelet count, well, it is associated with bacterial infection. So, antibiotics is used to treat these bacterial infections to help increase their platelet count.
General immunosuppressants. These are prescribed if the given medication to a patient do not improve their symptoms, or if in any cases that the patient has severe ITP, these are often provided. Now, the general immunosuppressants inhibit the overall activity of the immune system, not just the specific components of the immune system which are related to ITP. As a result, they can induce significant side effects. However, if not badly needed, these medications are avoided today as much as possible.
If you have severe ITP and medications doesn't improve your symptoms or platelet count, your doctor advised surgery to remove your spleen. This is called splenectomy. Splenectomy is usually performed in children because of high rate of spontaneous remission or unexpected improvement. Having a splenectomy also increases the risk of certain bacterial infection in the future. For emergency treatment, severe or widespread ITP requires emergency treatment. This usually includes transfusion of concentrated platelets and intravenous administration of corticosteroids like methylprednisolone, IVIG, and anti-D treatment.